My research experience at Mankato, I think it's been really fantastic. I really have felt a lot of support. I think every school has a unique view of what healthcare looks like. Every patient is a part of a family, and if a person gets sick, it impacts the whole family. Here, we're in this laboratory environment where we're really questioning, how can we research what the true effect is of things? How can we research what mannequins might do, but what don't they do? One of my research studies was on patient lifting equipment. A lot of hospitals were implementing lift policies, or zero lift policies actually, but every person is different. Nurses need to have technology available. Their expertise on how to use that is essential as well. When you are in a hospital, there's really three main parties: the patient and their family, the providers, and then administration. Those three need to be in balance. And often when you see problems with like the use of lifting, what we saw is that trying to decrease the expenses on injuries was the primary motivation. And so the other two kind of suffered under that. When I look at things as a researcher, what is the effect of things and not the intent? Because that is the key to improving things. My research has been able to be used to advocate for policy, for instance. What was a thought initially, it turned into a research study. We got some findings, and now it's being used by other people. The support from the College of Allied Health and Nursing, I have been very pleased with. I feel the leadership has really given me flexibility. For me, the main thing working with students is to get the passion of what research can do. And then the second thing is to help them get a voice in how do we tell that is hidden in the data. We have visiting students come here. We have scholars that we're working with to strengthen the voice of nursing globally. In the articles that I published, the students have key roles in that. And I've been really impressed with the insight they have brought. The latest studies that we've done would not have been possible without the students working on that. I've been really influenced by the philosopher Jacques Ellul. He talks about how every technology or technique has a shadow side as well, and that's what we should be interested in. And there's always this promise is this is going to solve the problem. And then working with patients or working as a manager, seeing that there are issues that come up with the use of equipment. I think we should be training students who are developing any kind of technology to start thinking that way, to say, not what does my research do, but what can it do that I don't want it to do? And be transparent. It's a great way to give students who really put in the work and really understand the research the ability to be a primary author so that they can be the next generation of researchers to change the world.